Great. So I am Abby Nallman, not Newman, it's a typo on there. I'm one of the key account managers with Bavarian Nordic. We manufacture Rabies, the rabies vaccine. We also have Nicole and Mary on the line, so I'll let them introduce themselves quickly.
All right, I'll go next. I'm Nicole Neiman. I'm the director for the veterinary technician program here at Dakota County Technical College in Minnesota.
And I'm Mary Durant. I'm an instructor here at DCTC in the Great White North of Minnesota.
Okay, great. So a little bit of background about who Bavarian Nordic is and why we're here presenting to you all today. So we are a leading biotechnology company that's focused on research, development, innovation, obviously manufacturing and commercializing vaccines, which is why we're here talking to you guys today about rabies vaccine. We also are committed to enhancing patient protection and extending superior care to our global communities, with dedication to establish trusted partnerships and providing education and support and services. In addition to that, we're also a part of an industry group with other companies. We advocate for fair access to ACIP recommended vaccines for persons that are occupationally at risk or exposed to various diseases. So just a little bit about who Bavarian Nordic is and why we're here presenting to you guys today. Most of you probably know this, which is why we're all tuned in today to this presentation. So a little bit about why we're here discussing this topic today. Most importantly, we share a similar goal. So we want to help protect veterinary health workers, technicians like yourselves from your occupational health risks. And because of the new AVMA release guidelines for protecting vet tech students, we've entered into a partnership with AVTE, we've branched out with Dakota County Technical College, and we've also branched out with Passport Health, who is a service provider to basically provide rabies vaccines for students. So as soon as we were able to connect with Dakota County Technical College in early 2021, they had proactively reached out to us. We wanted to help them and support them in this unique endeavor, allowing students to access rabies vaccine. I think this is something that is new in your field. And so as soon as they reached out to us, we were really excited about this partnership and wanted to help in any way that we can. So we, again, worked with them to help set them up for their first on-site rabies clinic, which was completed in November of 2021. And so we're just going to share today some key considerations for setting up a program like DCTC's, or some other options and resources to help other programs get started and kind of follow suit, just to make sure that they are in line with the new guidelines. So information we'll cover during this presentation, we will go over an exclusive school vaccination program model, which we have partnered with Passport Health, as I mentioned, to provide this on-site service for vet tech programs. We'll also go over accessing vaccine in other avenues. We'll go over supply and inventory and different alternatives to an on-site clinic. Dakota County Technical College, Nicole and Mary will talk from their experience, sort of a case study, how they set up their program, timing, delivery. We'll go through all of the key considerations for setting up a program. We'll share our contacts. And then at the end, we'll do a Q&A session. We would like to do the Q&A session through the chat box. So if you guys can send in your questions, we will address them all at the end, read them out, and we'll sort of pinball back and forth to each other. If it's appropriate for Nicole and Mary to answer, they will, for me. And we also have someone from Passport Health on the line if there's questions specifically for them. So the first model that we're going to go over is the Passport Health model. So this is a full service on-site clinic. Passport Health is one of our largest leading providers of travel medicine and immunization services in North America. You may be familiar with them. There's likely one in your area if you're in a major metropolitan city, or you may have heard of them for various different reasons. They have extensive experience in records management. They've been around for a long time. So this is something that they're familiar with. They do a large book of business in on-site vaccines for flu season. So Passport Health is able to come on site. They will basically handle all of your scheduling. They will do the student scheduling, program promotion. They will sign a contract for you. They'll determine your clinic dates. They provide a registered nurse that will come on site and vaccinate your students. They'll provide you data that you need for records management. So down the road, if you need to provide any kind of proof of vaccination or something for your accreditation, you'll have all of that information after your students are vaccinated. We also have a discount that is negotiated with Bavarian Nordic and Passport Health for vet tech specifically. So we've arranged that partnership prior to presenting this to you all. So there's a discount on the vaccine itself. There's some waived administration fees. And we also have access to rabies education through Passport Health as well. And you'll note in the bottom right-hand corner, Kimberly Bray is listed on here. She is one of the national account managers with Passport Health. There's also a few others that are working on this as well. So there's a general inbox. So any questions specifically for Passport Health after this presentation would go directly to that email, and the ladies there will be able to help you out. So the full service model partnership with Passport Health. As I mentioned, Passport Health is going to be providing on-site clinics. So they'll come to your school. They'll set up all the scheduling, reminders, registry, paperwork. They'll bring the vaccine, cold storage, the trained staff, and they'll clean up afterwards. So we're going to call this the pop-up on-site clinic. There is also an option if you live or your school is based in an area where there is a brick and mortar Passport Health office. There's also an option to go on site to Passport Health, and you'll be able to receive the same vaccine discount that BN is providing on site as well as off site. As I mentioned, Passport Health will provide your trained nursing staff, your schedule, coordination, student education. So what this looks like is you will schedule your clinics with Passport Health. So there'll be 3 dates, right? Your first, second, and third dose of the series. And they will schedule 3 different dates for your school, depending on what your schedule looks like or when you want to start your clinics. And they'll provide a nurse to come on site. And depending on how many students you have or hours that are needed, there's an hourly per diem rate for each nurse that comes on site. It's determined by geography. So I don't want to give any kind of specific number for a per diem nurse. If you guys are scheduling a clinic with Passport Health, they'll go over specific financials with you there. You'll also have a little bit more support as far as coordination, right? So if you're using them, they'll be able to do all the logistics and overall process and completion for the program. And you'll also have a contract that you complete with Passport Health so that if you want to continue this partnership in the future, the contract is evergreen. So every semester you can just continue to use them and reschedule, and you don't have to redo a contract every year. From a financial aspect, there are fees that are included in this. Of course, we're going to have our vaccine costs. So something to consider here, and with any of the programs that we're going to discuss today, is how we're going to pay for the vaccination. So are students paying out of pocket? Is this somehow going to be rolled into tuition, any administration costs? Something for you guys to consider at a school level. How is it going to be paid for? There's also some schools that are able to receive, or have to receive, state level funding. So just something to consider there if you're signing on to a contract with Passport Health or anyone and you need to receive state approvals. Nicole and Mary will go into a little bit greater detail in their segment about how they went about receiving state approvals if anyone has questions about that. And as I mentioned, the BN discount applies to the full vaccine course, and it's available to every student and staff member who works with Passport Health. There's also an option for a self-supported model, and this would be a school-run program. So there are some things that you need to have in place in order to be able to support this type of program. First of all, you'll need to have a licensed provider on staff. So you'll need to have an RMPA physician, somebody that has a DEA HIN number that's able to receive vaccine. So if you have a student health center on site, that would qualify for this. Just anyone that's able to set up an account with a wholesaler to receive product. So just some things that you want to consider here. If you are doing a self-service program, you would be receiving the product directly to your school. So you need to be able to store the vaccine in cold storage, disposal management. You need to be able to schedule the appointments for the clinics yourself. So you'll be receiving all the products. So however you want to vaccinate your students will be determined at your school. There won't be any outside support for this. Any paperwork that you guys need in terms of record management would also be a responsibility of the school. So just something to keep in mind there. As far as the financial aspect, it'll be pretty similar to the Passport Health portion. So the only difference here is you'll need to have your own wholesale distribution relationship. So what this looks like is you'll have to create an account if the school already doesn't have one with a wholesale distribution partner, so you're able to order your vaccine. You'll also have to pay for your vaccine through your wholesale distribution partner. So whatever their payment terms look like, things like that, that's what you guys will have to determine if that's something that's feasible for your school. If you have a student health center on site, you likely already have an existing wholesale relationship. So you'll just need to be able to access a contract for best pricing, which is something that I'll be able to help you with from the Bavarian Nordic side. Likely if you have a student health center that's already set in place. So we'll just make sure that you again are on an appropriate contract to receive product. And the third option is, so if neither of those options work for you, having someone come on site, or you don't have the infrastructure within your school to support a self-supported model, there are other options, right? So I think there's retail pharmacies, health departments, local hospitals. There's a lot of different avenues that you can go into to receive vaccine. We just want to make sure that everyone on the call is aware that there's ample vaccine supply in the market. However, an inventory level at a brick and mortar facility like a retail pharmacy may not always be on hand. For pre-exposure vaccination, it's not something that they would keep an abundance of. It's primarily being used in most of these spaces like retail pharmacy, hospitals, for a post-exposure scenario. So if you are going to send your students to any facility outside of the ones we've discussed today, you'll just want to make sure that they get advance notice, that they're able to ensure that there's inventory on hand so that the students can receive the vaccine. Something else to note here as well, for health departments, they are a great option, very cost effective. However, health departments may not always be administering vaccines. A lot that we've spoken to over the last year when discussing this program and specifically are kind of steering away from immunizations and are more of a resource to help people access whatever product they need. So you'll just want to double check and make sure wherever students are being sent to that there is vaccine on hand and that they are able to administer rabies vaccine for pre-exposure. And lastly, if anyone is seeking out alternative options to receive rabies vaccine, you can reach out to me directly. There's an email right here on the bottom. And again, you'll receive it at the end. I'm more than happy to help anyone find a location that is willing to work with them in their vicinity. So feel free to reach out to me at any time and I can help you guys access any type of vaccine that you need. And I am going to flip it over to Nicole and Mary, and they're going over their case study and all of their key learnings, being our pilot school and setting up our first on-site clinic.
Oh,
I was like,
all right, perfect. So we spent about a year to a year and a half trying to figure out logistically how this was going to work for us. Of the three options that Abigail outlined, we've kind of done the full tour of almost every single one of those options. Ultimately, what we decided upon was that we were going to have to partner with Passport Health. We do not have a human side doctor on site here at DCTC that has the license that would have provided us the ability to get the vaccine in-house and offer to do it directly through DCTC using that route. We also decided that we were going to kind of go through the steps that are outlined here on this slide. So we decided that in order to be able to provide the best access and service for our students, that we were going to take the cost of the vaccines and we were going to embed it into the tuition for the program for those students that were going to need to utilize this in order to be able to get those that series of 3 vaccines. We chose the way that our program is set up to divide that cost across 5 of our students' first semester of Vet Tech core courses. So we take that cost, we divide it across those 5 courses, and then that way the students don't have to necessarily pay directly out of pocket and bring handfuls of cash to campus and just start paying people. So what that means for us is, yes, as a program, we are able to decide if we want to embed the cost for certain things into the tuition for our program. But that does not mean that that is the end of that process. We do have something called a curriculum committee. We do have to request that the curriculum committee review that and see if that is something that they would agree with at kind of our institutional level. And our curriculum committee can use that opportunity to ask follow-up questions and to kind of understand what it is that we're trying to do so that they can see how that would be of benefit to the students. Once we get our curriculum committee here at DCTC to approve those funds to be withheld through the cost of tuition, then it does have to go above us to the state level at that particular point. And then once it's approved there, then we can start withholding basically the equivalent cost of what the vaccine funds are going to need to be used later to pay in this scenario Passport. We ended up having to set up, like I said, a contract with Passport Health because we don't have a healthcare provider on campus that we were able to tap into and utilize their licensure. So contracts can get to be kind of a little bit of a timely process. We do have to work with our business office here at the institutional level and figure out, what that contract is going to look like, get some legal beagles on board to be able to start sending paperwork and contractual language back and forth. Our contracts are generally going to be set up on an annual basis. So each year, then we have to renew and review those contracts and kind of set them up for the coming year. This gives us some flexibility in being able to make adjustments to the way that we decide that we're going to continue to run these clinics on campus. But the rest of the work for the most part has already been done once. So all we're doing is kind of, reviewing and renewing those contracts on an annual basis. What then happens once we get that approval to get that money built into the tuition for the students, we get the contract approved after many series of going back and forth with the legal people. Then we had to get our chief financial officer to essentially open up what we call a savings account. It's where those collected fees are going to then be transferred to and held in that account here at our institutional level. Then at the end of each of these series of clinics that we offer, we then get directly billed from Passport, and then we use the funds in that account to then pay those invoices. And so that way we kind of have the money kind of starting and ending with us there. Every year annually, the CFO will then preload that savings account for us with the anticipated funds that we're going to need, because we know that those funds are going to come in through student tuition. And then we're able to start doing those clinics immediately before those students necessarily start to take those classes. Over the course of the academic year then, every student that takes those 5 classes, those funds are going to then be withheld. They're going to be put into this account, so it kind of ends up being a wash at the end of the year. So then we just go through that process annually every year. You can go ahead and go to the next slide, please. I don't think I can. All right. So program setup and optimization. So this particular model ended up being a little bit more heavy of a burden here at our level. So myself, as the program director for the Vet Tech program here, I am the one who's kind of, I guess, lining things up and trying to make sure things happen in the order that they need to happen for us to be able to ensure that our students are vaccinated. I work directly with Passport every semester in order to be able to anticipate how many students I have coming in, how many students are going to need a vaccine, and all of that kind of paperwork and logistical tracking. I do have a finite amount of students that I start annually in this program at this point. So it's going to be pretty easy for me to be able to estimate those numbers from, semester to semester. Our first clinic that we did, we were kind of trying to figure out, I had about 42 students that I anticipated potentially might need the vaccine. We set up a 3-hour clinic initially to be able to ensure that we could vaccinate that many students. That also includes some administrative duties. For tracking purposes here, I have students are going to be signing in when they come to the clinics in order to get each of their doses. They do have to sign in. There's paperwork that we get from Passport Health as well. There's paperwork they have to do for them. So we do have to do a little bit of housekeeping. And then we do have to set up, and then we do have to then kind of clean up and, kind of close everything down. After we ran our first set of 3 clinics for the 3 doses of the vaccine, we've determined that we were actually quite efficient. Over the course of those first 3 clinics that we offered, we were able to vaccinate those students in about an hour. So going forward, we're going to make adjustments based on, what we're going to be seeing as trends as far as how long it's taking us to vaccinate our 42 or upwards of 42 students. That has been working well for us up until this point. The decision to vaccinate prior to the students entering animal handling classes, we decided we were going to work on this well in advance, obviously, of the CVTEA and the AVMA decision to make this a requirement. We were going to make it required kind of no matter what for this program here, because we felt that it was important to give our students the opportunity to get vaccinated due to the fact that we're high risk in this particular field. Our first clinic, we were vaccinating our students while they were taking their first set of veterinary technician courses. So we did not vaccinate them prior to animal handling use. So going forward, we're going to have to adjust that schedule, and we're going to hold clinics in August prior to the start of the semester to ensure that our students are able to get the full series of vaccines in August over the course of the month. And then when classes start at the end of August or beginning of September, we will have our students completely vaccinated with the full set of 3 doses. All right, next, please. All right, so a few things that we've learned. We have to make sure that we're considering if we're going to try to do this. We decided we were going to support our students here and offer these clinics on site so that our students had direct access in order to be able to get these vaccinations. Our students are on site for classes. If we run these during the week while the students are on campus for classes, we're able to then not ask the students to drive elsewhere to be able to get these vaccines. So location was going to be really important for us. We are considered to be in a fairly rural area, maybe not as rural as some other schools out there. But for us, we felt that was going to be, accessibility was very important for us. You have to be able to store the vaccines on site as well. So you do have to have a refrigerator that's going to be able to store those vaccines within, the temperature range that they need to be, which is the same temperature range that our animal vaccines are going to be stored at. Student communication is going to be a very big part of it. What I find myself doing is constantly sending out notifications, sending out emails to these students, reminding them of when these clinics are running, reminding the students of the paperwork that has to be completed. We do have a waiver process for students that are already vaccinated and don't necessarily need to get the pre-exposure vaccines. The students have to provide documentation that they have already had the full series of vaccinations. And then they have to fill out paperwork, and they have to sign this waiver and get it back to me in order for us to then refund those dollars that are being withheld in that particular student's tuition and get that refunded to them so that they're not paying for a vaccine that they're not receiving. For students that have already received the vaccine, we are requiring them to go and reach out to their healthcare professionals and determine whether or not a titer is going to be something that is needed. We're leaving that up to the human healthcare professionals. Students that are due for a titer or need to have a titer done will then need to also be able to provide us with documentation that they have had that done. Since this is such a new process and this is a new standard for us from the AVMA side, we decided that we're gonna really make sure we're documenting everything that we can so that we can adjust as necessary. Documentation storage. I am putting all of these documents that I'm asking these students to provide me with into their permanent student files for review during, like, say, an AVMA accreditation visit. That way I can provide that documentation and that proof that we are ensuring that our students are vaccinated going forward. The cost of the vaccine administration, I myself and Mary have been very active in being present for these clinics that we offer on site, on campus. We are there to help assist the nurse in being able to run the clinic and be efficient. The vaccines are sent to me in advance, and then I am storing them here under lock and key. And we are then making sure that the vaccines are secured. And then we are then sending back any unused resources as well back to Passport Health. Securing state funding, that has to do with a lot of the contractual piece. That's not necessarily going to be the way everybody handles contracts across the board. You may not even find that you need a contract in order to be able to do this. So timing is also going to kind of be a key component for you to figure out what is your academic year and how all of this has to work with your business office and other avenues up in upper administration. Partnerships with other schools. We do have several other vet techs here in and around us in Minnesota. Being able to partner with other schools, if you're close enough, you may be able to kind of combine resources a little bit. We have not found that that's going to work for us here, and having these relationships. So making sure that the appropriate personnel and licensure are going to be available, making sure that you're able to have a qualified licensed nurse here giving the vaccines is going to be important. I can help, but I'm not going to be able to administer those vaccines, obviously.
We can reconstitute, we're just not administering it.
Yep, so we're reconstituting vaccines and we are helping with the setup and the tear down. So at this particular point in time, it seems to be working really well for us. And I don't anticipate that we're going to go and try to look into doing another model. We did look into trying to find a doctor to partner with through our nursing programs that are offered here on campus. The cost of that was looking to be a little bit higher than what we felt was going to be viable for the program. So we opted to kind of settle on this particular model for us. We are paying the fees as a department. We are choosing to pay the fees for the Passport Health component of it. At this particular point in time, we are not pushing those fees over to the students at this point. We are just having the students pay for the vaccines so that we can streamline that process for them.
We'll also send out, there is a material or a resource that will be sent out after this, and it'll be a checklist that anyone can use, and it'll sort of help you identify, if you're considering either of these programs, which one is appropriate for you, right? So if you're thinking about doing a self-supported model, you can run down the checklist and make sure you can fulfill all of those requirements. If you can't, then you can switch over to the Passport model, run through that checklist, see if that works for your school, and also connect with Passport Health to make sure that everything on there and aligns with what you are trying to do as a school and a program. So we will send that out to you guys after this. And again, the checklist will kind of just help you determine which program is the best fit for your school. You'll also get this after the presentation. So this will just be all of our contact information. So any questions specifically for Passport Health in terms of pricing, clinic costs, if you were to go on-site, off-site, you can forward those all to the accounts at passporthealthusa.com. Email Kimberly Bright is one of the account managers. We also have Kelly Murtha on the call as well, who is one of the account managers that is handling this. Myself, there's a general email down there as well. So any questions about accessing rabies vaccine, specifically Rabies, I can help you with that. Whether it be a self-supported school model, working with Passport Health, or seeking out a third party that we did not mention here. Happy to direct you guys anywhere that you need to go or support in any way. And then, of course, any peer guidance and support from a school level. So any questions about how Nicole and Mary got to where they are, state funding, any of those things that they just discussed, They're available to answer any of those questions for you. And again, we'll send out everyone's contact information after this presentation as well. So any follow-up questions we can address for you. And the resources that I mentioned, these will be sent over to everybody after the presentation. And I believe in the future, they will be available to you on the AVTE website as well. And now we can move into Q&A. So I saw the chat box going.
Open up.
Hi, everyone. Sorry to jump in here. My name's, I don't know, I thought I put my video on, but I can't say. My name's Melina Leone. I work with Abby at Bavarian Nordic. And while the ladies have been presenting, I've been sort of triaging the questions on the back end. So Jennifer was gracious to allow me to sort of jump in here and triage. And thank you so much for everyone attending and for all these wonderful questions. I know everyone's got a lot that they want to get through. So I'm going to start, if people don't mind, and I collated some of the questions are somewhat related, so we could probably get through some of these relatively quickly. So as Abby mentioned, and I believe we've also mentioned on the chat, Jessica from AVTE will be sending out these resources via email. So I believe if you attended this session, we have everyone's email address. We will send these resources out to you directly. So yes, you will get the resources, and yes, they will be emailed. So that answers two of the questions. There are a couple of questions sort of related to rabies and rabies rates and rabies titers. So we didn't come today prepared to talk about rabies. We don't have our medical director presenting with us today. But I did ping him, so I do have some answers to some of the questions. So the first question that came up in this context, in this grouping of questions, was, has the percentage of rabies infected workers in our field increased in the recent past? And what is the infection exposure rate of those in our field at this time? Unfortunately, we are not aware if that information is tracked. So we as Bavarian Nordic do not have that information, so we cannot answer that question for you. So we apologize. I don't know if anyone else knows of a source within this community that is tracked, but we are not tracking that currently. Does anyone have anything to add on that one?
The CDC might have something, but again,
by occupation,
reported cases.
Okay.
But I know like the easiest thing that like we can kind of, I guess, spearhead off of why this is becoming an important thing is that, like, at least for the schools in general, that we're noticing is that we're having some issues in regards to the animals that we're bringing into campus might not have a solid vaccine history. And so depending upon the school and the animals that they're getting into their program with not having that confirmative vaccine history, we're concerned about our students who are going to be working with these animals with the potential of them getting bit. Because I know there were a lot of questions that were coming through, curious as to kind of why this is coming through and in sort of clinics. And I know it's going to also affect you geographically. So like in the state of Minnesota, for example, anybody who works with wildlife is required to have a rabies vaccination. And I think that's probably pretty fair across the board because you are working hand in hand with a rabies vector. But with certain schools and where they're resourcing their animals from, if we don't have that confirmation, I mean, it's kind of an ethical situation. We shouldn't be allowing our students to potentially get exposed to a potential rabies vector. I mean, a dog or a cat could be one if we don't have that vaccine history. So that's part of the reason I think why we feel it's important too that our students be vaccinated before they're handling some of these animals. And geographically, like I said, in your state, you might not be having that big of a concern, or you might not have that much of an issue in regards to what your rabies vectors are.
Great, thank you, Mary, for answering that. So the second question, I think the second part of the same question from the same person was, for those veterinarians or other staff who have been vaccinated in the past, say when they were in school 30 years ago, does their vaccination count? Do they need to submit a titer? And so the question is, for, I guess, those in practice that have been vaccinated a long time ago, and what we advise is that, let me just really get the answers I say. So a titer will be likely needed if you were vaccinated over 30 years ago to check your levels to see if you need a booster. And the CDC does have recommendations around, when those titers should be taken. And so we would advise anyone who's been vaccinated in the past, if they're concerned about when they should get a booster, they should get a titer and have their healthcare professional advise them on whether or not they need it. So hopefully that answers that question as well. There was a third question related to this, and I'm sorry, but I'm a little bit confused about how it's worded. So let me just make sure I find the person who asked it. And I think you're asking, what is the appropriate titer level? So let me see if I can, sorry if I can find the question. The question was, what is the value of titer number of rabies? I think that's what you're asking. Does anyone remember? I'm sorry, I'm just showing you questions. So if you want the appropriate titer level, I can put it in the chat, and I will do that now. That was answering that question. Okay, so that's the adequate titer level for rabies serum. Okay, so now we'll switch over to some additional questions. There's a question that says, is this available nationwide, all 50 states? So I assume that you mean, are these program offerings available? And the answer is yes. I believe there's Passport Health offices in all 50 states. Is that correct, Abby?
Yes, and even so, when it comes to Passport Health specifically, if you're asking if they're available in all 50 states, if you were doing an on-site clinic, you don't necessarily need to worry about where the closest location to you is, right? So they're coming on-site to your office, and that is not something that you should be concerned with, right? They're willing to work with the various schools and provide the service. So don't be as concerned with, I'm not down the road from one. That is something that will be handled with Passport. If you're asking if the vaccine is available in all 50 states, the answer is yes as well. So if you're doing a self-supported model, we can absolutely set you up with a wholesale distribution partner that ships to whatever state that you're in. And I believe someone else asked if it was available in Puerto Rico, and the answer is yes as well. We do have distributors in Puerto Rico that are able to send you product. I'm not sure if there's a Passport Health in Puerto Rico. Kim or Kelly, if you want to advise on that.
Hey, this is Kelly. I'm the National Account Manager for Passport Health. We are not currently in Puerto Rico. If there's enough of demand, I can go to bat for you, though.
And then, Abby, correct me if I'm wrong, but we can also work with them as a manufacturer side to, if they have a partner like a retail chain, we can see if we can work to get vaccine stocked if you want to send your students there, right? As a third option.
Yes, absolutely. So on that third slide that we presented is like, if you're not comfortable or going with the self-supported, meaning at your school, or the Passport model, and you just want to send your students out to receive it on their own, I'm able to support you to find a location that is offering the pre-exposure service and has the vaccine on hand. So I'm not sure if anyone will be on this call, but I have spoken to a number of you, and I know that a couple programs were doing that. And so they had sent students to like a CVS, a Walgreens, something like that, a retail pharmacy. And as I had mentioned earlier, it wasn't that they don't have it available. They're absolutely able to administer the vaccine to you. It's just not something that they're doing every day. So you just need to make sure that it's coordinated and that they're aware that the students are coming in so that they have the vaccine on hand to administer to you. So that's something that we can support you with on the Bavarian Nordic side. So if anyone's going to a third party, and I know some people have sent me locations that were near them that they were considering, I'm absolutely willing to reach out to them and work with them to make sure that the vaccine's on hand and they're able to accommodate all the students that you're sending their way.
Right. So there are a couple of questions, various questions related to insurance. And unfortunately, again, as a pharmaceutical manufacturer, we are not able to speak to every single solitary insurance company's plans. They vary by state, they vary by individual, they vary by institution you get your insurance through. So unfortunately, you're going to have to do a little bit of that research on your own should you need to go, if a student's going direct and wants to put it through their insurance.
And you can encourage them to just call their insurance company outright and just ask the insurance company, do you cover the pre-exposure, preemptive rabies vaccine? Because I'm going to school, it's required because I work with a rabies vector. And that's another thing on another note is that we are currently working, it's a slow process due to COVID, but we are working with someone at the CDC and trying to get the verbiage changed and having veterinary technicians and veterinary technician students put into a higher priority of category. So that way, when they do take it to their insurance companies and the insurance companies goes to the CDC website and they see that we fall into a more higher priority of a category, they will be more willing to cover it through the individual's health insurance to hopefully allow that coverage versus them having to pay out of pocket. Because obviously, right, we would hope at some point our health insurance could jump in and cover the cost of the vaccine, because we know it's not cheap. But until that happens, this is kind of one of those alternative options for us that we can do right now to fall within the parameters that are being asked of us.
So as Mary said, there's work being done on the back end behind the scenes with the CDC, as well as Abby mentioned in the beginning of the presentation that we as a manufacturer are part of a larger group, a consortium of organizations that are working in DC to help change the legislation as well, to help support occupationally exposed individuals to various viruses. So unfortunately, it's not something that can be just changed overnight, but there are a lot of people working behind the scenes to try to increase this coverage, because we do know not all insurance plans cover pre-exposure for certain occupations. So we understand that that's variable, and that may be something that those of you have to deal with, but unfortunately there's not one answer that sort of covers everyone holistically. So hopefully that gives you a little bit more guidance there.
Something that may be helpful for other programs. So in my meetings with various directors and administrators, some programs do supply their students with a letter explaining the reasoning behind the vaccination, right? It's a requirement to enter this program. It's an occupational health risk. I'm not going to say that I know that it works or doesn't work, but it can't hurt to try that. And I think that supplying them with that kind of explains why they're receiving the vaccine, and maybe it will trigger something with, I don't know what it would trigger in their plan, but a couple of different schools do have something like that. So maybe if there's anyone in the chat that currently offers that to their students when receiving their vaccination and is comfortable sharing, it may help another program as well.
Yeah, and I will agree with Abby on that as well, because I do remember when I was in school, it was a requirement in my program, and my program did have a letter that I brought with me to the doctor's office, and then I also had to call the insurance company and they did cover it due to the fact that we had that letter stating why we needed it.
Okay, there's another group of questions that are sort of related to this topic around timing and what happens. How do you get students vaccinated prior to school starting? How do you vaccinate students that are 3 or 6 hours away? How do you support distance learners? So some of these questions were kind of asked prior to Nicole going through the case study. But as we kind of the theme of this presentation is there's a couple different ways to kind of approach the situation as a school administrator. And so we've offered you sort of a comprehensive list of here are all the considerations and variables that you need to kind of walk through for your individual school, your individual students' needs. Every school has different funding levels and different budget levels and different processes. So like DCTC did, they kind of went through and said, here's what we have, here's what we don't have, here's what we need. And they kind of came up with a customized program. So what we hope to accomplish today was, here is a comprehensive list of all the different things you need to think about. Here's an example of how one school did it. And then here are resources you can call to have specific conversations about your specific school, so we can figure out the best program for you and the best options for you. So things like, how much will it cost? When are we going to administer this? These are all things that are hard to answer in this sort of group setting because there are a lot of specific variables to your school. So we just encourage you to reach out to Passport Health, to Abby, to us to figure out, we can sit down with you and figure out how to walk you through the process and figure out which one's right for you. So we're not trying to avoid your questions. It's just difficult to answer them for everyone because everybody's answer may be different. Someone asked about the cost of the series. And so that will vary as well, depending on certain variables, but know that we are providing a discount through the full series through the Passport Health program. And Passport Health is also providing some discounts as well. Again, we can't talk about the specific price because they're going to vary depending on geography, how many nurses you're going to need to administer. There's so many variables. So again, please reach out and we can work the numbers for your school specifically with you directly after the call. Okay, let's see the other group of questions here. So So someone asked, they came in late, they asked, does this have to be administered through an MD? Or could it be purchased and administered administered by a nurse? So I know we have to have an MD license in order to receive product, but I believe it can be administered through a nurse. So I know you guys are shaking your head. Do you want to answer that question?
Yep, that was something that we tried early on. We have a bunch of medical programs on campus here, and we kind of just assumed that there is a medical doctor on staff, which there's not. And dentists don't count, in case you were thinking of looking, because we went that route as well. So if we had had a doctor on staff already tied to one of our programs, we could have had our nursing program directors and even some of the students vaccinating some of their students vaccinating our students. Unfortunately, it wasn't cost effective for us to try to partner outside of DCTC to be able to do that. I even tried to convince them that my doctor's license should work, but it didn't work. So the cost of liability insurance for a human doctor is more than a college is going to want to incur. We did look into that as well, because we did have a doctor that we had worked with previously on the human side. He hadn't been practicing for a while and was more than willing to partner with us if we covered his liability insurance, and that was not going to be something that we could do. So if you do have the ability to come up with a solution for that, you can absolutely, like we have a nurse on campus here, and she kind of handles all of the stuff for the entire campus. If we had had a human medical doctor on site, she would have been able to be the one to administer our vaccines on site. We just weren't able to accomplish that here. So we decided that we were going to go this route instead, because it was a little bit more cost efficient. So if you do and you have the ability to partner, you can absolutely, there's nurses, if you have nurses on campus for other programs, you can absolutely do that, and you can cut out a lot of middle ground and cost.
Or find somebody you can sweet talk.
Or
That's
sweet talk
legit.
somebody. Yep.
So Jeff Myers asked the question, can Passport Health work with our nursing program for the vaccine administration? So I think, Jeff, what you're asking, correct me if I'm wrong here, is that can you get the product through Passport Health, but your on-site nurses would administer? Is that what you're asking? If you're still on? I don't know if anyone can answer that question, but.
He said yes in the chat.
Oh, okay, sorry, I can't see, I'm up higher.
That's okay.
So I don't know if Passport wants to answer that question. It seems like it's a hybrid of the two options we're offering, but.
Yeah, so we can certainly partner with the nursing students on there so they get credit. I find for rabies specific events, it's not going to help with costs. There's usually just not enough shots to be given to make a difference when it comes to cost. It is a good experience. One of our providers has to be on site, only one. So you can have 10 students there to give 10 shots. It's really up to you guys. But we'd be happy to have nursing students, and we've done that several times.
Great, thank you. So someone asked a question, I'm not sure of the answer, if anyone else on the panel has the answer, but if you embed the cost of the rabies vaccine administration in the tuition, does financial aid cover it?
I don't know. Yes. It just depends on how expensive your program is. So, because I'm not the financial aid or money person. So I know that there's a limit to how much the students can get in financial aid award money per semester. So as long as it's added to the tuition, that's what they're billed for. So yes, they can absolutely apply financial aid towards it.
Great, thank you.
Which is also part of the reason we kind of chose to do it that way. I didn't want students coming to campus, with thousands of dollars in cash and trying to hand it over to somebody to get, vaccinated. So
there's a question here about how are you going to have them do it before they have paid anything to the school yet? So I think the question that you're asking, Dawn, is how are you vaccinating students prior to getting into school or paying tuition? Is that what you're asking? I'm not sure if that was answered, Nicole, and you were explaining that you preload the account through the school. So maybe you want to talk a little bit about that.
Yep. So yeah, our chief financial officer will preload and load dollars into that savings account. That's what I call it. And then we're only going to have to pay for the ones that we actually administer. So it's kind of a check and balance system. So we preload this cost center. We don't have to wait for tuition to come in necessarily. And then, what am I trying to say? I don't understand the financial part of it completely. It's a cost center, not a savings account. It's a cost center that's tied to the program. The CFO preloads it with dollars from somewhere above us. Like I said, I don't understand it. I don't understand it exactly. I know how to accomplish it now. So then the money is sitting in there. Once our students receive the vaccine and they're in the class, then they're going to be charged the tuition dollars. Then that tuition money is going to be withheld, and it's going to kind of replace, that money that's in there. The students are going to get charged. Every student's going to get charged for the vaccine or the dose that they actually received. So that's how we're check and balancing at this point. It's a little cumbersome on my part because I need to make sure that if I have 15 students get vaccinated, that I'm only getting charged for 15 vaccines. Otherwise, it's going to cost my program money if I mismanage those vaccines or that money whatsoever. So it becomes my responsibility to a certain extent. But so far we haven't had that issue, I guess. Knock on wood. So we were thinking we were going to be able to accomplish this a little bit more smoothly until the CDTEA sent out the notification that said that they had to be vaccinated prior to animal handling. So last semester, we were vaccinating our students at the beginning of the semester when they started animal handling classes. So we weren't quite preloading the cost center quite the way that we're going to have to going forward. So like, for example, this August, I'm going to schedule the 3 doses in the month of August. We're going to give the students the vaccination before they start the classes at the end of August or September. There is a way within our internal workings to be able to still charge a student, I believe, and we haven't encountered this, so we don't have direct answers, to still be able to potentially charge or collect that money if in case that was something that were to occur. Our fiscal year is July 1st through June 30th. So after July 1st, that money is available. So then we're going to be able to use it right away in August for our upcoming fall semester. I hope that answers the question.
Yeah, and if I could just make one comment. So if you're asking specifically from a passport scenario, how do you pay for it before the semester starts? Obviously, Nicole and Mary have expressed that they have rolled everything into their tuition costs. But if students are paying for it out of pocket, that's something that the students would work. Like, so if you schedule an on-site clinic with Passport and they come on site, however you determine you're going to pay for the clinic itself, right? So for the on-site clinic fee, for the nurse fee, however you want to pay for that would be one thing, but the students can also pay directly for the vaccine itself. Kelly, maybe you want to explain that a little bit better than I'm explaining it, but.
Sorry, getting unmuted.
Okay.
Yeah, so we can accept payment from students directly at the time of vaccination. It's not usually ideal. I like to keep my nurses focused on, immunizations rather than cash handling, but it is something we can certainly accommodate.
There were a couple of questions about distance learning programs or programs that have students that are 3 or 6 hours away. How are you going to get them to the clinics? So I think, again, this is one of those variables. You have to go through your checklist, know your school's needs and your students' needs. There's a couple of ways I think you could support this. You could send students to a local retail chain. We talked about that. So if I'm not sure exactly, say your students are within a geographical area, you might have to send them to multiple places. And so we just have to be careful about there being an inventory there waiting for them. Or there are Passport health offices as well. So again, if it's a variable that you need to work out a solution with, you would have to sort of work with us and with Passport Health to figure out the best solution to support your distance learners. Again, it's hard to just, give an answer off the cuff here without kind of understanding the geography where the students are. Is it rural? Is it urban? Are there other schools? If you have other schools, like Nicole had mentioned, if there are, 6 schools in a state and they're kind of all around the state, you might be able to create a program where students can get vaccinated across any of the schools. There's lots of different ways you can get creative and figure out a way to work for you. So again, encourage you to go through the checklist, write up those areas where you know your school has a special need, and like talk to us, and we'll just be creative problem solvers and help you figure it out the best we can. I know we're close to time, Jessica, so I don't know if I should keep going or what we need to do here.
Well, that depends. Are there any open questions, that really pressing questions we haven't hit on yet?
Well, I noticed that there was one of the questions out there that was asking about how they know that it's currently a series of 3 vaccine, but there has been discussion, yes, about it going to a series of 2 vaccine. That change has not happened yet, but I know it is something that is kind of in the works or in progress or in discussion in regards to that. And I know a lot of people have been talking about sharing a letter and things like that for knowledge for you guys with the program that we've had thus far. We haven't had any students actually ask for a physical letter. They've just done the process and talked to their health insurance, and either their health insurance will say yes or no. And so far, all of our students who've gone through their health insurance have had health insurance coverage just by them stating that they need it for their program. So, but a letter definitely isn't a bad idea, and I would certainly encourage it for sure.
Is the CVTE not accepting the 2-dose series? Because I spoke with the doctor. There's no way to get a vaccine in the county where we are located, but I found a doctor in a neighboring county, and it is a 2-dose series.
So until the CDC publishes updated guidelines, it's technically still 3 doses. So that's all we can say. They will publish it in the WMMR. I can never say that. MMWR, excuse me. And that date is still pending. We don't know when they're going to publish any updated guidance. So until then, it's a 3-dose.
When I had my CVTEA visit, they told me that the CDC was working on a 2-dose series. And so when I found the doctor and he's like, yeah, it's a 2-dose series, I didn't question it, even though the CDC says 3-dose series. And he says that the CDC has approved this 2-dose series.
Until it's published, it's not technically effective, but yes.
Okay, thank you.
Thank you. There's a question here about, I thought it was an interesting question. Can you explain your vaccine waiver process? What modifications do you have to make for unvaccinated students to complete hands-on skills and tasks? Or what are your mitigation strategies to use for unvaccinated students? I know that's not part of the presentation today. I don't know if that's something you guys are willing to talk about, or maybe that's a topic for another presentation. But we're not here to talk about the policies or how to adhere to the policies as a manufacturer. But I don't know if the schools want to speak about how they're handling on their own and share that with each other.
Yeah, we're still in the process of working through that. We have notified our student population that is a requirement. The students that are currently far enough into our program where the tuition, we're not going to be able to withhold those dollars through the tuition. We are directing them out and having them go elsewhere and work with their healthcare provider to be able to obtain the vaccination. So we got the CVTEA notice in January with everybody else. So even though we had already started this process here, we do have to make adjustments over the course between now and August to be able to offer it. We also have discussed trying to figure out how we could still offer it to our students here through Passport, with potentially working through, there was the question about working through Passport with the healthcare provider and insurance provider for the students. We've had quite a few students. I'm actually kind of impressed and shocked that we've had quite a few students that have been able to get their healthcare insurance provider agrees to cover the cost and are actually able to get the vaccination at this point. So we're still working through that process. So unfortunately, I don't have any more information right now at this point.
Did we have any students who refused the vaccine? I don't think we did.
No, we didn't have any students refuse the vaccine.
Yeah, so Jessica, there's some questions again about mitigation strategies, and then someone's asking, do any colleges already have this in their budget already? I don't know. I think that would be a very proactive school that maybe would have gotten in the budget last year for this year, but maybe there's an opportunity for a second sort of discussion where as schools start to figure this out, they can share some best practices with each other. I think that might be a really nice follow-up session in a couple of months before school starts in the fall.
Yeah, no, definitely. We can definitely work something out based on all the interest on this topic. And
there
keep
also-
developing. So
Yeah, there's also going to be discussion at the conference itself too.
Yes, we'll be there as well, all of us.
There's a question out there that says from Jess Fox, how did you know to already start this process before the email in January? So Jess, our process was we were looking to establish this as a part of our program before this was made a decision with the ABTE, CBTEA. We had a student who got bit by a cat, and the student didn't have any known health insurance. We didn't know the status of the cat, and we were kind of in a pickle and wondering what we were going to do. And so that kind of spearheaded the process where I started contacting companies and asking companies that had the rabies vaccine and trying to figure out a way that we could start a rabies vaccine program, because both of us had it as a requirement in our program, and we had wanted that to kind of be implemented into our program. And so I had sent out emails to all companies that I knew that carried the rabies vaccine, and sadly, no one had responded to me at all. And then out of the blue, one day, someone from Passport Health, I think it was Brian, had emailed me, and I was literally sitting at my desk, and I was like, the heavens have opened up and fallen down on me. And they actually had found me from NAVTA, because I'm a district representative for NAVTA. And he, I guess, had emailed a lot of the representatives, and I was the first one to respond. And so that kind of got the ball rolling and the conversation happening long before we had anything happen, knowing that what was coming down the pipeline with the CBTEA and the ABTE. So that's kind of how that started.
Yeah, so it was Brian at Bavarian Nordic, and we were kind of thinking about underserved populations as well as we were doing our planning, and you were reaching out to us, so we kind of serendipitously figured out that you know, your underserved population, these guidelines were coming, and so that's how we kind of started the thought process a year ago to figure out how can we set something up, get some reduced vaccine, get a vaccine partner for schools, like, so it kind of got the ball rolling. So we owe it all to Mary.
Jessica, can I say something? This is Chad Brown. So if there are any other online directors on the call, we're actually organizing a meeting between all the online directors this coming Friday to talk about mitigation plans and basically what the online programs are doing in regards to the CBTEA policy. So if any of you, many of you have reached out already and have been included in the Zoom invite, but any online directors that would like to be involved, I can put my email address in the chat and I can send you a Zoom link for this Friday. So I did want to add that.
That's awesome, Chad. And if there's anything we can do, if you come up with ideas and you need help with getting supply to certain retail chains or anything like that, please reach out to Bavarian Nordic. We can help with the supply part of it.
Yeah, I think that's going to be an interesting part because some online directors are already just saying, well, they're going to require it. And boy, that sure seems like the good route to go. But I don't know. It's going to be an interesting conversation on Friday, that's for sure.
And Passport Health can help as well too, right? We said there's lots of locations. So again, as you come up with needs, let us help you brainstorm some solutions, whether through Passport Health or through Bavarian Nordic, you know, for any of the variables that we specifically can handle.
Yeah, I had wrote it in the chat because there was a lot of questions coming through around cost. So cost specifically, if you're looking for the Passport Health model, you'll want to reach out to the Passport Health accounts email that you'll receive after, and they can go through all of the costs that come in that program, the vaccine costs, on-site clinic fees, everything that goes into having an on-site clinic. And also if you were to go to a brick and mortar building, anything outside of that. Of course, I can help if you want to connect with Passport Health as well. I'm available to kind of bridge that gap for you guys or help make the connection. But anything outside of Passport Health, will also be able to support you with. So whether it's going with a self-supported model and receiving product directly at the school, or if you're looking to use someone local to your area, whether it be a retail pharmacy, independent health system, anything like that, you can reach out to me directly. There'll also be an email that's provided after this. So feel free to send all your questions regarding costs, and we can address them one-on-one, depending on your needs.
There was a question, does Passport Health have their own liability coverage? Kelly can answer that one. Yes. I assume they're a vaccination company.
Yeah, the answer is yes.
Okay, I don't want to answer for them if they were on the call. I'm just going through these really quickly. People are asking for copies of the letter that they send to insurance companies. So maybe someone can offer that up to Jessica and she can share that out.
I pulled it from the chat and I will include it in my email.
Okay. I don't think there's any other questions unless I missed it.
No, not that I saw.
There was one, what about immunocompromised individuals?
Oh, I missed that question. What is this?
Real quick, I'm going to jump in for Passport. Sorry, my kid came home. Yes, we have our own liability coverage, and every contract has indemnity language that your legal team and my legal team will discuss.
So the question for immunocompromised, what about immunocompromised individuals? Will this CBTEA allow for that if they have a doctor's note? So I don't, is the question, are they looking for a waiver because they're immunocompromised? This is Christy asked this question.
She says yes.
Oh, okay. That's something you would, I mean, that's something you have to work out with the school, obviously. That would fall in the category of not wanting to be vaccinated. We do have a vaccination schedule though for immunocompromised patients. They get an extra dose, right? So you'd have to talk to your healthcare professional and you'd have to talk to your individual school about how they would put mitigation in place for you. Plans to discuss it.
And I think just if I can make a quick comment. So in reading everyone's questions, I think there are going to be a lot of one-off situations too, but I wouldn't let that discourage you, right? Because there's always going to be like one outlier that comes into play where you're like, oh my gosh, what am I going to do? But I think that at least our goal for this presentation was to kind of give you guys an idea of where to start and kind of thinking about how you can incorporate this into their programs. And then once you have a good idea of what you can actually facilitate at your school level, then the outliers will come through and kind of make sense. And I think that they'll work themselves out. But I think from our perspective, we really just wanted to give you guys a baseline understanding of what we've come together, thought out, worked through, and we think will hopefully provide your schools with a solution for the immediate issue, which is students receiving the vaccination.
Unless there are any other questions, I know I would just like to say on behalf of all the presenters, thank you so much, Jennifer and Jessica, for allowing us to come and have this presentation and discussion. We hope it was of value. We hope we continue the discussion. This is just the beginning. And we wish everyone a lot of luck with this. It's a big undertaking.
Thank you. Thank you.
And before everyone jumps off, I do have a quick announcement I'm sure everyone would like to hear. Before I get to that one, real quick, just another little plug. Award nominations, guys, open till May 15th. Don't forget to submit a nomination, recognize your fellow vet techs. But thank you, Abby, Mary, Nicole, Melina, for doing this for us tonight. We really appreciate all the information and your experience that you shared with us. And it just does start the conversation. So I'm sure things will develop down the road and another one of these will be needed. So there was a question about the recording. The recording and the resources will be sent out to attendees by the end of the week. Just gonna give me a little time to do some editing. And the important announcement. Our lovely president came up with this code, discount code RABID, okay?
RABID. I'll type it in the chat box.
Okay. If you use code RABID when registering for the conference before April 1st, you will receive a discount on your registration. So code RABID, don't forget it.
That's awesome.
And we had to do it. We had
Jennifer.
Love it.
to do it. Erin, did you register when you were already on here? Sorry, there's a comment. Registered an hour ago.
Oh, no.
Ow! I got you, Erin. Don't worry about it.
Hey,
All
Jess. Jess, this is
Right,
Kathy Bliss. Do we get a
Right,
presenter
right,
discount and a rabid discount for being like a rabid presenter?
I mean, if you want to try both on there, go for it, girlfriend.
We like rabid presenters.
You do like rabid presenters over in the ABTE.
Okay, then.
You get a discount for presenting?
You do. Mhm.
there is
didn't
a
know
secret
this.
discount, yes.
Yep.
Do I
Our
have
little
to
way of
put
saying
that
thank
in
you
an
for
email?
the time.
Shoot me an email. Shoot me an email. Okay.
Write that down too.
That one's not going out into the world. Just shoot me an email. But again, thank you everyone. And I'm writing down Erin's name.
Yeah, thank you guys so much, presenters and everybody that came to this. This was amazingly helpful, and we appreciate everybody taking their time off to participate in this.
Yeah, awesome turnout.
Fantastic.
I think we broke records on this one.
Yeah.
Woo!
You did,
Yes.
for sure. All right. Well, I wish everyone a fantastic rest of your night, and we will see you soon.